Okay. My name is Carrie Sheets. I'm a nurse practitioner student, and today I'm going to be conducting a cranial nerve exam. We're going to be doing the cranial nerves of your head and your neck, so that's cranial nerve 1 through cranial nerve 12. First, of course, I would do my hand hygiene, and then I would confirm name and date of birth of my patient.
Dimitri Gotonaga, February 3rd, 1988.
Okay. So first we're going to start with the olfactory nerve, which is a sensory nerve responsible for smell. This is cranial nerve 1. So Dimitri, please occlude your left nostril and do deep inhalation. Okay, and then the other side, please. Good. Okay, so you have good patency, good airflow in both nostrils. I have 2 different smells here. I'd like you to please close your eyes, occlude one of your nostrils. You can just look straight ahead. And then I'm going to give you one smell. What?
Lavender.
Lavender, okay. And then please occlude your other nostril.
Coffee.
Okay, good. So you got both of those correct. So your sense of smell is intact. Next, we're going to be doing cranial nerve 2, which is a sensory nerve again, mediating vision, looking at the optic nerve. So for this one, we're going to be checking your central vision. We're going to be using the Snellen test for visual acuity. We have that hanging straight ahead. And then we're going to be looking at your peripheral vision and doing a fundoscopic exam of the back of the eye as well. So first, I'll be doing I have this instrument for you here. I'll have you close one of your eyes. Before we get started, I just want to verify that you do not wear any glasses or contact lenses.
No.
Okay, go ahead and occlude, your left eye. Great. So with your right eye, you're going to go ahead and look at the chart ahead of you, and then please read the smallest line that you're able to make out.
D, E, F, P, O, T, E, C.
Okay, and then, close your other eye with that instrument, and then again, please read the smallest line that you're able to make out.
D, E, F, P, O, T, E, C.
Awesome. So you have 20/20 vision bilaterally. We're going to be checking the peripheral vision next, so I'll actually have you turn towards me, please. I can go ahead and take this from you. Actually, no, we'll use this for this again. So for this one, you're gonna only look straight at my nose. I'm gonna be holding up fingers in all 4 quadrants. Don't follow my fingers, just look straight at me and then tell me how many fingers I'm holding up. Okay, yeah, so go ahead and cover your left eye, looking straight here.
2, 1, 2, 2.
Okay, good. And then the next side.
2, 1, 3, 1.
Good. Okay, so no visual field defects. Moving on to the fundoscopic exam, I'll take that instrument from you. So for this one, you're going to, again, just find an object over there and focus on that, looking straight ahead. I'm going to start farther back, looking at your eye, and then I'm going to come up close and really get a good look at the muscles in the back of the eye. And I'll state my findings afterwards. Okay, and then for this test too, so I'll be using my right eye to examine your right eye, my left eye to examine the patient's left eye. Okay, here we go. So starting back, just getting a good look at the eye, and then moving forward, really looking at the back of the eye. Looking at the retina, we're looking at the veins, the arteries. Okay, and then I'm gonna use my left eye. Start back, looking at the eye. Then we're gonna come up. Okay. So the patient has a distinct disc. The retina is orange appearing. No disc cupping. No disc edema. No hemorrhages or tortuosity of the vessels. And the veins appear to be larger than the arteries at a 2-to-1 ratio, all of which is normal findings. Okay, so for cranial nerve 3, 4, and 6, we're going to test those all together. They are motor nerves responsible for muscular movement. So 3, we're going to be looking at the superior rectus, the inferior rectus, and the medial rectus, along with the levator function of the upper eyelids and the size of the pupils as well. For cranial nerve 4, that's going to be looking at the trochlear oblique muscle, and 6 is the lateral rectus. So first we'll check pupillary reflex. I'm going to grab my pen light that I have here. So we're going to check with this pen light. We'll be looking at the direct response and the consensual response. So looking at one, seeing how the other eye reacts. So go ahead and just look straight ahead, please. I'll bring the light source over and into your eye, but just stay looking straight ahead. Okay, and the other. Good. Okay, now one more time, but we'll be looking at the response of the opposite eye. Good. Good. Okay. So the pupils are 4 millimeters bilaterally, equal, round, reactive, and brisk response. So next we'll be looking at accommodation. So for this one, you're going to just be looking straight ahead. Okay, and then look at my finger. Good. And again. Good. Okay. So the eyes converge, pupils constrict, and the patient has prula. So moving on, we're going to look at the extraocular eye movements. So this is the 6 cardinal positions of gaze. For you, I'm going to have you look straight ahead, but actually you'll follow my finger this time. So here we go. Oh shoot, I'm sorry, my computer. Let's start that one over. Okay. Okay, good. So you have smooth movement, no nystagmus noted, and no paralysis of the eye muscles noted. Moving on to the corneal light reflex. So you're going to actually look straight ahead. I'm going to be shining light at the bridge of the nose, and I'm looking for the right light reflex in each pupil. Okay. Good. Okay. So he has symmetric light reflex. Now we're going to do the cover and uncover test. So for this one, we're looking for any eye muscle problems or misalignments centrally. Okay, so go ahead and just look straight ahead. We're gonna cover, uncover. The other side. Okay, good job. So the eyes stay fixed and there's no movement, which is good findings. So then we're going to be doing cranial nerve 5, which is the trigeminal nerve, which is sensory and motor. So we're going to be checking the muscles of mastication. So keeping your mouth closed, you're going to clench your jaw. Okay, good. So strong response. And then you're going to Keep your jaw closed like that, but then move the bottom side to side. Good. Okay. So full range of motion there. Then the sensory portion of this is going to be the 3 tracts of the nerves, so the forehead, cheek, and chin. I have an instrument here to use for sharp and dull sensation. So I'll give you a demonstration on the top of your hand what you're looking for. So this would be dull, and that's sharp.
Okay.
Okay, so go ahead and close your eyes.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Good. Okay, so sensation is intact. And now we're going to be moving on to cranial nerve 7, which is also sensory and motor for the face. So for the sensory portion, we're going to be checking taste and your tongue, and then motor, we're going to be checking the muscles of the face. So for this one, I'm going to have you give me a big cheesy grin with your teeth. Okay? And then raise your eyebrows. Good. And then puff out your cheeks. Good. So good symmetry with all of those 3 movements. Good symmetry bilaterally. Then we're going to be checking cranial nerve 8, which is a sensory nerve responsible for hearing. So first we'll be starting with the whisper test. So I'll have you occlude your left ear, and then I'm going to whisper 3 things, and please tell me, just repeat what you hear.
Water. Couch. Picture.
Good. Okay. Same on the other side, please.
Coffee. Microwave. Window.
Okay. Good. So hearing's intact bilaterally. Next, we're going to be doing the Weber and the Rhine test. So for this one, I have a tuning fork here. I'll be striking the tuning fork, placing in the central part of the top of your head. And I want you to tell me if you hear the sound in both ears equally, or if it's stronger in one ear than the other.
Okay.
Is it stronger in one ear than the
Same.
other, or is it equal?
Equal.
Okay. So that would be a normal finding. Next is the Rhine test. So I'm going to strike that, place it in the mastoid part of your ear. Tell me when you stop hearing the sound.
Stop.
I'm going to move it to the external outer ear canal. Please tell me when you stop hearing the sound.
Stop.
Okay, so for each of those tests, we're timing that, and it looks like he had in the right ear stronger air conduction, longer air conduction time of hearing versus bone conduction, which is a normal finding, but we're going to do the same test in the other ear as well, timing the mastoid portion and then the outer ear canal portion.
Stop. Stop.
Okay, so same on that ear, the air conduction time was longer than the bone conduction time, which is a normal finding. So no hearing loss. Next, checking cranial nerve 9 and 10. So 9 is the glossopharyngeal. This is responsible for taste, and we're looking at the posterior tongue for that. Cranial nerve 10 is the vagus nerve, checking the sensation along that vagus nerve. The motor portion to this is the posterior mouth. So let me grab my pen light and my tongue depressor. I'm gonna have you stick your tongue out and say ah, please.
Ah.
Good. So good. Uvula rises midline, no deviation with that. We're gonna do this one more time. Okay, gag reflex is intact. And then I'm gonna have you swallow. Good, so checking the muscles along the neck. Cranial nerve 11, which is the spinal accessory nerve. So this is a motor nerve mediating the trapezius and the sternocleidomastoid muscles of the neck. Okay, so for this one, I'm going to have you shrug your shoulders up. I'm going to press against them. So good, strong, full resistance there. Then I'm going to place my hand on the side of your face and lean against it, please. Good, and then push against it on this side. Good. So he has good push and pull resistance. Last but not least, we're going to be checking cranial nerve 12. So this is the hypoglossal, which is a motor nerve and responsible for mediating tongue movement. So for this one, you're going to stick out your tongue. Good. So there's no deviation. Tongue is midline. Then you're going to press the tongue on your cheek. Okay. And on the other side. Good. So strong movement there. And that completes our cranial nerve 1 through 12. Thank you for being a good patient.
You're welcome.
And we'll see you next time.